Let's start with this. It's just so everybody's on the same page. We're talking, this is a VMware solution. It's a software solution. I mean, talk to us about the solution itself. Like if I were going to get it and put it into my health system, what would it look like?
Absolutely. The solution is called VMware Edge Network Intelligence, but in our partnership with GE, our special healthcare version of this is actually GE OnWatch NP. That's the solution name. And if your hospital IT and wants to see the solution, basically the solution sort of has multiple elements. One of them is what we call a crawler. And this device basically collects all of these different data sources that I talked about. So it looks at packet data, right, inside the hospital. It talks to Radius servers and Wi-Fi controllers and switches and routers and things like that over different protocols, whether those are SNMP or the packet data that's protocol agnostic, or whether it's some API that's required to talk to Wi-Fi, and things like that, collects all of this data. And the solution itself is based in the cloud. So the crawler is extracting metadata from all of these different systems and sending the metadata back to the cloud where all of the big data analytics happens, right? And so that's sort of how the solution is architected. And of course, customers can choose, you know what, I don't want things going back to the public cloud. So AWS is one option for us. But if they want, they can actually deploy the backend in their private cloud as well, so that they can have all the data stay on premise.
Keep an idea, literally years working with the Niansa and then VMware team on the solution. We built a custom dashboard with them that was kind of tailored to the biomeds and the critical devices that they manage. So we can see in a nutshell, what are my priority alerts? What are my problematic devices? And then that's kind of stacked ranked by the impact that you'll have on the hospital or on the people. Like if it's an infrastructure problem, that'll be a higher priority than an individual device that's having an issue. But we can also see total inventory. We can see where devices are, work closely with them to get it working on our CareScape networks. GE has thousands of these networks deployed all over the world. And these are the segregated networks in many cases where customers want to protect their legacy devices or just their clinical devices by having them on a separate network than the rest of the systems in the hospital. And those networks are protected. They're sending patient monitoring data, telemetry data, electronic medical record data. And we put their sensor on and we're able to have a lot of visibility into what's happening, who's communicating. Is the communication normal? Are there abnormal things happening, or are there unauthorized devices on those networks? So it can start to play into a security role by making sure that only the right communication's happening over the networks during business.